Today, you and more than 1.1 billion people will be experiencing the same debilitating pain of migraine. It's a condition so complex that even healthcare professionals have been scrambling for years to understand it fully. And while medications can sometimes provide relief, they can also lead to a vicious cycle of long-term headaches. But what if there were simple strategies to help you take control when a migraine strikes? Let's start with the basics. Migraines are not just headaches. They're multifaceted conditions that require a deep understanding of how your brain and metabolism work. If you're watching this, you're likely all too familiar with the warning signs, those subtle changes in food cravings, energy, and mood that signal an impending migraine. It's as if your body is sending out a distress signal, urging you to prepare for the storm ahead. If you've had migraines for many years, you will know exactly what I mean. But did you know that migraines have distinct phases? The aura phase, which can occur anywhere from 5 minutes to an hour before the attack, is like a warning siren. It manifests as blurry vision or those funny hollow lights on the periphery of our vision. But only about 1/3 of migraines have them. And that's why recognizing these phases is crucial for the effective management of migraine. Now, what if you had an emergency kit at your fingertips, ready to spring into action the moment you see a migraine approaching? A migraine kit could be a lifeline, adding essentials like a paper bag for nausea and vomiting, an eye mask or earplugs to block out light and sound, a portable ice pack to calm the pain, and of course, your emergency medications, lotions, and potions. Keep this in your car or overnight bag when you're traveling, in case the migraine strikes unexpectedly. It might be a good idea to have a few of these in places that you know you can reach quickly in case of an emergency. Now let's talk about the strategies that can help abort a migraine once it starts. It's essential to differentiate between abortive therapies and long-term management strategies. Think of abortive therapies as fighting a war. They're necessary in the heat of the moment, but they're not the path to long-lasting results. Long-term management is about building a harmonious relationship with your body and brain. Now, what do we do when the migraine starts? Abortive medication like paracetamol, ibuprofen, along with your prescribed medications like your triptans, gepants, or other CGRP inhibitors can provide relief if they're taken in time and if they're prescribed for you. Take these as soon as you can at the onset of the migraine. But for those who prefer a more natural approach without the risk of side effects like medication-induced headaches, high-strength ginger powder has been shown to be almost as effective as sumatriptan, with the added benefit of near no side effects. Imagine being able to take control of your migraine with something as simple as ginger. The dosage for ginger is 250 milligrams at the start of the migraine. It can be taken every 2 hours for a maximum of 1,000 milligrams a day and is readily available over the counter. This is definitely worth trying as an alternative to your medication. And then there's caffeine, our favorite morning pick-me-up. While it's generally advised to avoid caffeine due to its stimulant effects, it can actually play a crucial role during a migraine attack. Caffeine not only amplifies the effectiveness of the medication, but also interacts with other systems in the brain and body to help abort the migraine. Just one espresso shot or 150 to 200 milligrams of caffeine can make all the difference. Or you can include some caffeine tablets in your migraine kit just in case. But it's not just about the substances we take. It's also about how we care for our bodies during an attack. Drinking water or ginger tea helps replace the lost fluids and supports the HPA axis, a hormone pathway linked to migraines. So make sure you grab some water if you suspect that a migraine is lurking. And for those who try to do something different, capsaicin, a chemical responsible for the burn in spicy food, has shown remarkable benefits in reducing migraine pain when used as either a nasal spray or a cream. In fact, studies have shown remarkable results using a nasal spray just once at the onset of migraine, while rubbing capsaicin creams on the temple and the head and the neck show great benefit. As the migraine takes hold, it's time to lie down, remove yourself from gravity and movement, and try to sleep if you can. Use your eye mask and earplugs to block out the world, and place a cold pack on the back of your head if possible. It's time to quiet the mind and soothe the body using techniques such as CBT or biofeedback if you're familiar with it. Warming your feet with a warm water bottle during an attack can also be incredibly soothing. So trying the capsaicin on the feet if you can't get to your trusty water bottle is another alternative you can try. And while aborting a migraine is crucial, it's only part of the journey of long-term management. Long-term management is where the true peace lies. But as we explore these strategies, it becomes clear that certain substances like caffeine can play a dual role in migraine management. This leads us to a fascinating question. What is the role of caffeine in migraine management? How does it interact with the brain and body during an attack? And what are the implications for both short-term relief and long-term management? Let's dive deeper into this intriguing aspect of migraine care and uncover the secrets that would change the way that you manage migraines forever.